Hi everyone, welcome back to New Beauty Talks. I'm features editor Tatiana Bito, and today we're talking about body sculpting procedures with Baton Rouge, Louisiana, board certified plastic surgeon Dr. John Williams. But before we get started, I wanted to show you our new issue with the iconic Catherine Zeta-Jones. Doesn't she look gorgeous? And equally as important are our 11th annual New Beauty Awards, which we've scoured every beauty product to tell you what is the best of the best. And if you want to know more, you should join us on April 21st at 8 p.m. where we're going to have a New Beauty Awards live event. We're going to celebrate. It's a star-studded event, and you don't want to miss it. So let me patch in Dr. Williams and let's get started. Let's see, we're connecting. Hi.
Hello.
Hi, Dr. Williams. How are you?
I'm fine.
I'm so happy you're able to join us today. You're renowned for your body work, so this is wonderful. And now that we're in spring, I know everyone's thinking about their summer bodies. So just if you want to introduce yourself and just let our followers and readers know a little bit more about you, that would be great.
Sure. Well, I'm a board certified plastic surgeon. I've been in practice a little more than 30 years, and I do a lot of body contouring, and that includes basically everybody wants to know what areas, especially for the summer. And
Yeah.
I'd say basically from the neck down to the knees and in between and everything in between. So we look at everything, the breast, the tummy, the hips, the thighs, especially now the butt, and everything else. So that's what we look at.
And right now, I'm hearing from all of our doctors that they're busier than ever, that this is just everyone is sort of living their dream and going and getting things fixed that have been bothering them for a long time. So what are some of the common body concerns that you see patients coming in for?
Well, one of the things that is we do a lot of are breast problems. And so often the breasts are too small, sagging, or too small and sagging, or possibly even too large. So women want to be able to wear a nice summer dress, but they also want to be able to wear shorts, and they want to wear a swimsuit if they want to. So those are some areas that you want to be able to have able to wear all these different types of summer apparel. So certainly the breast is one area, and of course then we see a lot of problems with the tummy. It's either too bulging, too sagging. It's not tight enough, and maybe there's a little too much fat, So it depends on exactly what is the problem with the tummy, what we're going to do.
Right.
And so certainly that's a major consideration, another major area.
Well, the waistline is definitely a concern. And I mean, I'm speaking for myself. I don't know about anybody else, but this year my waistline is completely different than it was last year. I'm a little bit softer, but I know a lot of people are going through that. So what are our options if we want to streamline our waistline or get rid of some of that little extra fat that we may have acquired in the last year?
Right. Well, it depends basically upon how much fat there is or adiposity, and if you have good skin tone or you don't have good skin tone. Now, classically, one of the things that we would do, especially for the hips or waistline, is that we would do liposuction. And one of the newer concepts that we have now is that when we do liposuction, we also do what we call body tight. Now, body tight is radio frequency that helps to remove the fat, but also very importantly, helps to tighten the skin. Because one of the things that you don't want to do is remove fat from any particular area, for example, in the waistline, and have sagging or whatever. and it
Right.
might make that kind of muffin top even a little more, but have a little saggy muffin top. So
Right.
we don't want to have that. All right.
No.
So no, we don't want that. So what we do is do a combination usually of liposuction with body type, which is radio frequency skin tightening. Now
Okay.
that's a surgical procedure. And of course, then we have other methods too. Of course, one of the most common is cool sculpting. And then we have non-invasive radio frequency. So in
Right.
cool sculpting, we're freezing the fat. And in radio frequency, we're melting the fat. Two different kind of concepts, but they work to remove the fat. And one thing I should comment about is this, that the problem with diet and that is that when you diet, what you're really doing is you're decreasing the amount of fat and the size of the fat cells, all right?
Okay.
Now, so you diet and you're doing great, all right? But then you stop dieting and the fat cells increase their fat and get bigger, all right?
Right.
So it kind of goes up and down. When we
Yeah.
do
I'm
these,
familiar. I'm familiar.
right? So when we're doing these techniques, all right, what we're actually doing is removing the fat cells. So those taking the fat cell out, and once the fat cells are taken out, they're not going to grow back.
Right.
But there is one little thing, is that we're not removing all 100% of the fat cells, because otherwise you would get skin kind of scarring into the tissue. So some of the fat cells are remaining underneath the skin. So if you increase your amount of caloric intake, you are then going to probably increase the amount of fat as well. The fat cells that are there are going to get bigger. They enlarge. They're not going to get more of them, but they do get bigger.
So when you describe the first procedure, it's not just the traditional liposuction that we've come to know. You're also combining it with a minimally invasive procedure to get that skin retraction in certain patients, right?
Yes. And another thing I should mention too, of course, when we talk about, especially in the tummies, but also in the waistline, what we're now doing is what we call liposculpture. Now, everybody asks, what's the difference between liposculpture and liposuction? All right. Years ago, we did, and we still do, liposuction. Now, I went over to Paris, a long time, I'm going to remember, but anyway, with Dr. Illouz, who was the inventor of liposuction, right? And at that time, we were just basically sucking out the fat.
Right.
And we would remove the fat from everywhere we could. But now, a little different what we're doing, we want to define the muscles over the fat that we're removing. So we want to show the muscles of the abdomen and the muscles over the flank areas and make that look as if you've been working out for the last 3 or 4 or 5 months. So this is a different technique. We're removing specific areas of fat, which we didn't do before. We removed everything, but now we're removing specific areas of fat to really show up and define those muscles and give you a nice toned appearance to the abdomen and the stomach. A little different.
So it's like the name implies, you're using the remaining fat to sculpt out definition, the appearance of muscles and more tone.
Yes, exactly. So we never did that before, and we started doing that probably about 3 or 4 or 5 years ago. And this really has kind of basically revolutionized what we're doing in liposuction. So it's not just liposuction. Actually, what we want to really do is get a toned, sculptured appearance to the abdomen, not just removing fat. Because a lot of times what we would do is do liposuction, and the patient will go, well, I'm thinner, but I don't really look that much better. You know? So now we want to
now
really
you get a more hourglass shape and a more toned look to go with your more active lifestyle, right?
Right. And we want to make you not only look good in your summer dress, but also in a bikini. So you show up your abdomen.
Right.
Okay.
So how if I was a patient coming in, or I was coming in for a consultation, before I come and see you, just looking in the mirror, how would I know okay, I'm probably going to need a tummy tuck and not a liposuction procedure. What is a good measure?
All right. So the major thing that we're looking at when we're deciding whether it's going to be liposuction or tummy is, do you have skin that is hanging over your pubic or groin area when you're standing?
Okay.
And if you do, you need a tummy tuck, because if we do liposuction in that area where you have kind of skin
Right.
fat hanging over, what's going to happen is it's going to make it worse. It's going to look terrible. It's going to look like
Right.
an apron draping over your pants. It doesn't look good. All
You
right.
so you would still be smaller, but you would still have that little bit of a muffin top or overhang. That
Exactly.
doesn't go away.
It could be little, or it could be a lot. That would not look good. And
Uh,
another thing that we're looking at is this. We're looking at, do you have bulging? So, all right, after pregnancies, this is very, very, very common. Most women have it because your muscles in the midline of your abdomen separate, all right?
Right.
They divide.
Right.
It has to do that. Well, those muscles never go back together. I'm telling you that. You never do. I don't care.
Right.
You can do 1,000 sit-ups.
Mhm.
But what we do in a tummy tuck, we're going to sew those muscles back together, all right? And we're going to reduce that bulging, and besides taking out the excess skin. And of course, that's kind of the painful part of our tummy tuck. Now,
Right.
that's the bad part. The good part is now that we are using Exparel, so we're injecting those muscles with a long-acting anesthetic that's going to release these little microspheres, to release this anesthetic and give you pain relief for about a good 3 days or more.
Okay.
Your recovery period is going to be a lot faster. It's also safer because you're not sitting in bed, you're not lying in bed, and you're able to get up, move around, and your recovery period is going to be a lot better, a lot less painful, and faster, and a lot better. So tummy tucks, again, they've changed a lot, the way
Right.
we're doing them.
Yeah. And if you get a liposuction and you needed a tummy tuck, in the end, you're not getting the full benefit or the best result you could get. So it's important, I think, for people to know, because it can be confusing.
Yeah, it is confusing.
Yeah.
And so that's what we do. When we look at that, we have a patient, we look at that. Now, sometimes those patients need liposuction along with a tummy tuck, and we do liposuction as well at the same time. But we try and make the patient realize that liposuction is not the overall end all, especially if you have bulging stomachs and saggy skin.
Right.
Okay.
And I'm going to assume that you do a lot of mommy makeovers, because if it's me, I just want to do it one time. I don't want to keep going back. So I would assume a lot of people right now are doing procedures for the breast also to get ready for summer or swimsuit season.
Right. We do a lot of, especially for mommy makeovers, we do a lot of breast lifts along with breast augmentation. In other words, we do that at the same time along with the tummy tuck as well. Now, what happens, again, with pregnancies a lot of times is that the breasts become basically deflated. In other words, you've lost tissue and they sag. And so another important point is this. If you just do a breast augmentation and you've got sagging, drooping breast, what you get is bigger, sagging, drooping breast.
Got it.
Does not look good, all right? So what we do, and we advise the patient, we go through this very carefully, is that we want to make certain that if the patient has significant sagging of the breast and also has deflation, in other words, lost fullness, that they understand the best option is to do a breast lift with breast implants.
Okay. And then a breast lift without implants.
Yes.
Do you have other options like a fat transfer? What do you recommend?
We've done fat transfers along with a breast lift for those women that want to avoid having breast implants, all right?
Right.
Now, breast implants have changed dramatically in the safety and the types of implants that we now use. However, some women just don't want to have that. So, of course, one option is just do a breast lift. Don't add anything. Now, you can do fat injection. The only thing to know about, one thing really I think is important about fat injection is that when we inject fat, whether we're injecting into the breast or the butt, which we do a lot now, a lot or a significant amount of the fat may go away. So that the person having this, woman having this done, has to understand that when we fill the breast with the fat and give her her augmentation, it may not be as full as she would like down the road.
Right. There's only a certain amount of it, like a certain percentage that stays permanently.
Yes, it's usually around somewhere around 30 to 40, maybe 50%.
And then if you have a breast lift with an implant, if you've had larger breasts, if you've had sagging or drooping, would you get a smaller implant so that they're higher, they're lifted, and you don't feel that sort of heavier chest that you've been walking around with?
Right. No, so now this is maybe surprising, but we often do breast implants with a breast reduction. So in other words, a person comes in and says, oh, I'm a triple D or an E breast size. And however, their breast tissue is sagging down to their belly.
Right.
You know? Well, but they don't have any fullness in the upper breast.
Right.
So if you just do a breast lift with a breast reduction, they still don't, they don't have that nice fullness and roundness of the breast. So surprisingly, even though we may doing a breast reduction, we're placing an implant to give that person that nice fullness in the upper breast. It's terrible to do a breast reduction and you come out and you're flat in the upper breast and you don't have cleavage, and it just doesn't look good.
Right.
So we're doing a lot of things that kind of even sounds counterintuitive, like a breast reduction and then you're putting implants.
Well,
but that's why we're doing that.
I think anyone who has children completely understands what you're saying.
Yeah.
You want the lift. You want them to be where they were at one point. So, and sometimes you do need an implant for that. Okay, so let's talk about non-surgical options for body contouring. You talked about CoolSculpting.
Yes.
And when you spoke about the ab muscles being connected, there's a lot of electromagnetic devices right now that can stimulate the ab muscles.
Yes. Would
you get that similar effect if you underwent those type of treatments?
Well, yes. The newer treatment is of course called M-Sculpt, all right? And what it does is stimulates the muscles to contract, and particularly in the abdomen. So what it does is to tighten those muscles, and particularly in the midline of your abdomen. Now, the only thing realistically to know is that, yes, it tightens those muscles, but if you have a significant amount of separation due to pregnancy and maybe multiple pregnancies, it's not going to help that. But it will help to tighten the muscles of the stomach, the waist, the waistline as well, and the legs, and even the buttock.
And those are just a handful, maybe 4 sessions, non-surgical.
Right.
Nothing is going inside of you. It's all external, and it's stimulating the muscles to contract.
Yes, that's right. And it's done over about a 4 to 5 month period of time, with either several weeks to a month in between treatments.
And what about, you mentioned fat freezing, CoolSculpting, which I think all of us know about now. What are the benefits of CoolSculpting for someone who doesn't want to undergo a procedure?
Well, the benefit is that, again, it's an outpatient procedure, and it's particularly good, I would say, for the hips. I find it probably not quite as good for the abdomen because basically there are pads that are put on the areas of treatment, and it's the results of that is related and limited to the areas of where the pads are. So
Right.
kind of above and below, it doesn't treat that well. So, and particularly in the abdomen, I feel it doesn't work quite as well. I think it's very well in the hip areas as well.
Right. I think too, if you have like a little pinchable fat, you're a great candidate. But if
Oh,
it's a
that's
handful
fine.
of fat, it's not going to do what you want it to do.
Yeah. See, the major thing that we're looking at is how much adiposity, how much fat you have, how good your skin tone is, and everything.
Right.
And that's very important, because to have a good result, you can't have take out 2 pounds of fat and think
Right.
it's going to look real good.
Right. Okay, so what about the arms? This is a problem area for a lot of people, and you could do a ton of arm exercises and diet, but you really can't spot treat certain parts of the body. So what do you recommend for the arms?
Okay, for the arms, it depends on the amount of laxity and if there's also amount of fat with that. Now, if there is not a great amount of sagging and a small to moderate amount of adiposity, what we do is a combination. Again, we use liposuction and we use radiofrequency, body type, minimally invasive skin tightening along with the liposuction. And a lot of times what we'll do is not only liposuction up, when you hold your arms out in that area where it's sagging, but also on the top of the arms, we want to create some definition as well. Yeah, you just don't want to have just, so we want to create, where you have the delta, see your muscle. And so we do that along with the liposuction and body type. Now, for those individuals, unfortunately, a lot of women are not candidates for that, because they, especially say, a lot of women have undergone weight loss,
right,
bariatric surgery, and all that. Well, there's a significant amount of sagging. Now, the major problem about an arm lift is the incision that is usually placed on the inside of the arm. And so for years we did that, and the arm lift, we said, oh, that looks great. But women hated it. It was terrible. Right. Why? Because of the scar. It looked terrible. And you raise your arm out, and what do you see? This big old scar. So what I've done in the past several years now is don't do that incision on the inside of the arm. I do an incision on the back portion of the arm.
Okay.
So when you raise your arms out, you don't see a scar.
Okay.
It's on the inside back part of the arm. And most people, when they're wearing most even short sleeves and everything else like that, it's on the inner back portion of the arm, and you don't see that.
So your incision is further back.
It's on the back portion.
But if you were looking at someone from behind, you wouldn't see it.
If you're looking at from the total back portion of the arm, you might see a little on the inner back of the arm.
Right.
But you don't see anything, when you raise your arm out, you don't see any of that. And for the most part, you don't see much on the thing. And there's another, actually, to me, a technical part that's very important, is that the skin on the inner portion of the arm, that's always been done, the kind of the classical surgery where you do that, all right, is very, very thin. And so it stretches out and spreads out and gives you just a miserable looking scar. It's wide, it's terrible. Anyway, so on the back portion of the arm, that's skin is much thicker, it heals better, it doesn't separate and spread and all that. So I really find this is, I guess, a newer way of surgery to do this. But I thought, well, where are we doing this incision on the inside of the arm? People hated it. But now they're able to raise your, I mean, they do, it's horrible.
No, it's true. It's true. It's a very, intimidating scar when you see it. And most people who have upper arm fat, kind of have a bat wing. I'm speaking from
Yes.
experience, have that bat wing, and you can't, non-surgical modalities aren't going to really get rid of that
Right.
sagging skin. So that has always been the trade-off. It's interesting that you're talking about where you're placing the scar. That's the first time I've heard that. So
Yeah.
that
Well, I
makes
don't
it a
think
little
too many
less
people
intimidating.
do that, but I'm telling you, that's really honestly the
Yeah.
best way. Done that for 15, 20 years, and I said, this is terrible because you get rid of the sagging, but then you're defeating,
Right.
in a sense, the purpose. The reason why you're doing this is so you can wear
To show
short
your arms.
sleeves and raise your arm out to the side.
Yeah.
And you have a big old scar. It's terrible, So we're not doing that anymore.
Okay, Rosemary 1317 wants to know, what state are you located in? And Dr. Williams is in Baton Rouge, Louisiana.
That's it.
And you have patients coming from everywhere, right?
Yes, I do. I see a lot of patients from, of course, neighboring states like Texas, like Florida, Arkansas, all over the place.
Yeah. And if you have any questions, if you're watching and you have any questions, please feel free to comment and we'll answer them for you on body sculpting procedures and getting your body ready for summer. Okay, we talked about the arms and we know our options there. Cool sculpting is also an option for the arms, right?
Yes.
But every subject we're talking about, I feel like you fall into one or another category. If you have good skin tone, or if there's more sagging skin, then you're going to have to excise it, right?
Yeah. Then you need surgery, and if not, you can do that. And of course, one advantage of some of the non-invasive or minimally invasive is that if you still have that problem, you can always still have surgery. It's not
right.
It's not one or the other.
Right.
You can still do that.
Yeah. So we're going to just keep moving down the body. What about the thighs?
Okay.
And I feel like the thighs are having a moment. There's more focus on the thighs nowadays. I don't know if you can tell me, has the procedure changed? Has the thigh lift changed? Is it easier to tighten that area nowadays?
Well, what we do now too is is if there is not really a lot of huge or very large amount of fat or sagging skin, you can do liposuction. And we combine that with a skin tightening procedure. I think the thighs have been one of the areas where you have to be more careful with your liposculpting and liposuction than almost any other area, because if you take out a significant amount of adiposity from those areas with some skin laxity, then what's going to happen is that you're going to increase the amount of sagging in that area, and then certainly then you would need what we call an excision, where we actually remove the excess skin and tighten it up and actually bring that up. And what we've done, one thing a little different is that we're now tightening the skin, and the incision is for the most part in the natural skin crease of the pubic groin area.
Okay. So it's hidden in that fold.
Yes.
And then the skin. Sorry, go ahead.
A lot of times we combine that with in the buttock as well, because a lot of times if you have sagging in the inner thigh, a lot of times there is sagging in the lower buttock. Now, when you think about buttocks, everybody thinks, buttock BBL, right?
Right.
That is true, but the other operation that is done is that sometimes you have sagging in the lower buttock. In other words, the lower buttock is kind of sagging over the upper thigh.
Right.
Your thigh. So what we do is that we can remove and tighten that skin there, and that also helps to lift and tighten and certainly improve the overall shape of the buttock combined with your medial thigh lift. So we do that too.
So when you say you can lift and tighten, is that the body tight procedure?
Yeah, that's the body type procedure. And then we can also surgically do that as well.
Okay. And then a lot of people have, there's been safety concerns with BBLs in the past um but how trending are Brazilian butt lifts at your practice? Because I feel like they haven't really gone away.
Oh, they're not, well, not only have they gone away, I think when we have overall consults, we see probably about 30% or so of our consults are involving doing a BBL,
Yeah.
Brazilian butt lift. In other words, they'd like to have liposuction, and since they're having liposuction, they'd also like to have a Brazilian butt lift. And of course, our concepts of that have changed, and the way that I do it, of course, has changed a lot over the past few years too, as well, for safety reasons.
Right,
So
right.
I do, for example, I don't do the other operation that we did years ago, or I did years ago, where we took syringes of fat and injected that into the buttock. I don't do that because I think that can be a problem as far as sterility and safety. And so I do what we call is a pulsed lipofilling procedure that doesn't use fat syringe injections or anything like that.
And that makes it safer.
Yeah, see, well, what we do is that we collect the fat in a sterile container, and then what I do is we process the fat, and this is all a closed system now. We're not having anything open or anything like that. We take that fat, we run it through a pump that is a variable speed pump into a liposuction cannula. Instead of doing liposuction, now we're injecting it. And we can actually pulse this fat very evenly and very efficiently and very quickly into those areas that we're doing the Brazilian butt lift. And so it's a totally closed system, it's efficient, and it's very, it actually works much better. It's a very even procedure, how we're doing it, because it's a even pressure, how we're injecting it. And the areas that, of course, what we learned, as you know, is that we do not inject fat into the muscle.
Right.
Because that had disastrous results.
Right.
Say disastrous is
an understatement.
Sure. Yeah.
Okay, I have a question from Lillian Gutierrez. I have suffered all my life from back pain and low self-esteem as a result of being born with a big buttock or big butt. Do you have any recommendations?
Well, it depends on what the size of your buttock is due to. And if it's due to fat, excess fat, then you can do what we call liposculpture of that area. Certainly, that's for sure. If it's due to enlarged muscle, there's very little, unfortunately, that you can do for that, unfortunately. But you would have to be evaluated and seen, and it is possible to improve. I would certainly think that certainly that could be improved.
We have another question from Charming Desert Rose. I have big thunder thighs. We're going to call them thick.
Yeah.
I have thick thighs. What is the correct way to slim them down?
Okay. Well, usually what that is there's increased adiposity of both the front of the legs, probably also on the side or the lateral aspect of the leg, and also on the inner aspect of the leg. So in those cases, we do liposuction or liposculpture on those areas. And that generally, in fact, I did a lady not 2 weeks ago, and we removed, which is surprising, but we removed over 2 pounds of fat from the front of the thighs. That's a lot. And she had, and there again, it was, she tried diet and exercise and just couldn't get rid of it. Just no way. So what we then, those were certainly thunder thighs. And, you know, and so I say just in the front, we removed 2,000 and about another 1,000 or so on the other areas. So it was basically the max amount of fat that we take out from just so those areas.
And it's the same measure that we talked about before. If you have sort of hanging skin around your inner thigh, you may not be the best candidate for a liposuction. You may need the thigh lift. But if you have a little bit, just a little bit, that looks like it can retract, then you would do the lipo and the combination body tight to skin tighten. Okay.
Yes, the rate of frequency, yes.
Yeah. And I just want to say all thighs are beautiful, and thick thighs are beautiful. So, one question I wanted to ask you is, I've noticed a lot of times when someone has liposuction, they get this automatic shape with their butt without having to have a BBL or their butt touched at all. They get a nice result just from having their waistline carved out or sculpted. So do you have a lot of patients surprised at that, or surprised to see that their back has such a great result without having to do a BBL?
Yes, in fact, when we do BBLs, we almost always do the waistline and the hips, because of the fact that when you contour and take in that waistline, it automatically gives you increased a visual increase in the fullness and the size of the buttock, and gives you a more called hourglass shape.
Right.
So we always do that. Almost always do that.
Yeah,
that's an excellent thing.
I've asked a lot of people, like, did you get a butt lift? And they didn't. They just had gotten, liposuction, and having that shape, it affects your whole body. So I do have more questions here. And thank you, everyone. Keep asking questions. This is great. Are there any risks associated with liposuction?
Well, yeah, the risk is that we can't take out, for example, too much fat. Now, one of the things that we want to be certain is that you're basically in good health, and that's very important. So we check labs, and one of the things that is important is that we check what we call a CBC, or hemoglobin, or hematocrit. For example, now, years ago, when we first started doing liposuction, it wasn't unusual that a person would lose a unit or a couple units of blood. That's serious. But now with the newer types of liposuction that we're doing, and I do a pulse assisted liposuction, a power assisted liposuction, the amount of blood or bruising that we have is very minimal. Right. I can just tell you that when we did liposuction with other methods years ago, the person would look like they got hit by a truck.
Right. Right.
They look very, very bad.
It's a little more sophisticated now.
Looked terrible. It was awful.
Yeah.
So now, I just saw a patient just a few minutes ago, and we did her liposuction of the hips, the abdomen, and we did a BBL, and she has no bruising. And this is 4 or 5 days later. So our methods have changed, but it is important. Yeah. What to be careful about? Another thing is you have to make certain it's done in a very sterile environment. This is not something you want to go to somebody's office in some room and have liposuction. This is not the stuff you want to do. Right. Man, you can have some major complications like infection and bleeding, all kinds of stuff. So, it's got to be done carefully. This is not some, thing that you just go into some salon and have your nails done in liposuction at the same time. You're
going to want a board certified plastic surgeon for sure.
And someone who knows how to do liposuction has done them and done them and knows how to do it well. The other, of course, complication is that we always say it's not so much how much you take out, it's how much you leave. So when we're doing liposuction, you don't take out fat directly underneath the skin. You leave a little layer. You want to maintain a contour to the body, whatever area you're doing. So that's another thing, very, very important.
Okay, and then we have another question about tummy tuck after C-section. So I'm assuming if you have a tummy tuck after a C-section, how long should you wait? And can you hide the tummy tuck scar or blend it in with the C-section scar?
Okay. Well, usually it's good to be at your ideal weight. So in other words, after your pregnancy and your C-section, you want to be at your weight, hopefully, maybe prior to your pregnancy. Now that may not ever happen, but at least you want to try to maintain or get to your ideal weight.
Right.
And once you do that, then that's the time. Now that might be 2 months later, it might be 8 weeks, 8 weeks or so, it might be 3 months later, it might be 6 months, but whatever, in that time. So we don't have a specific time. It's actually related to how your weight loss is and if you're stable. In other words, we don't want to be doing a tummy tuck and you're still losing 5 or 10 pounds a month,
Right.
Right. And then regarding the scar, almost always what we do is that we do the incision below the C-section scar.
So underneath it.
Underneath it, we're taking out that scar. We don't make another incision, my goodness. So we're taking out that scar that you had for the C-section.
Yeah.
And a lot of times what happens, and a lot of women notice this, so you have the C-section, and then you get that kind of bulging a little above the C-section, that kind of scars in. So we're taking all that out, and we're going to then pull that skin and tighten the muscle and get you flat, because a lot of times I've seen so many C-sections where the skin above it is kind of bulging over that. It looks terrible.
Right.
So what we're doing, we're going to take out that C-section scar, take out the scarring that's associated with that, and then do our tummy tuck.
This is so fascinating, especially right now, because I think this is on a lot of people's minds. I just want to, this always happens when I do an interview with a doctor. I want to get on the plane and come and see you and get everything done that we just talked about. Okay, one more question. What if you regain the weight? And this goes for every part, the thighs, the arms, the tummy. If you do like, back fat, liposculpting.
Right.
What if you gain it back?
All right, what if you gain it back? That's a good point. Well, unfortunately, if you can't remove or decrease that fat with further diet, then you can have some of these procedures done again. It's not, it's not just once done and done. Unfortunately, I have had patients over the years that will come back and say, oh, well, I had liposuction, I did this, or I had that, and it's, it has come back. And it's interesting that you pointed out, you just said what we call the back bra fat area.
Yeah.
I'm seeing much more of that, and I think that's another important area that is kind of like neglected or missed a little. My patients don't miss it, but I'm saying that that is an area that we are doing much more because there again, you put on your bra or a bikini top, and you get that bulging above and below. No, so we want to really look at that area when we're doing, say, liposculpture of the hips, and include that as well. And that is one area that
there's a lot of that, and sort of like the side of the breast too. I think that's all kind of related if you get that liposuction procedure. But I think we all just want to look really good in our clothes. And that's a major pain point for a lot of women, especially women with large breasts or women who have gained a little bit of weight. You get this band around you, and it's impossible to get rid of. So this is all so fascinating. Thank you so much, Dr. Williams, for sharing your expertise with us today. Is there anything else we should be thinking about before summer?
Well, I think we covered most of the.
I know.
I think we covered most of the the topics. And I'd
Yeah.
say when we're looking at for summer, especially, it's kind of like from neck to knees and everything in between. So we look at everything.
Yeah. And if you want to get in touch with Dr. Williams, you can follow him. He's at Plastic Surgery of Baton Rouge. And it's been wonderful. Thank you so much,
That's
Dr.
great.
Williams. And for our followers and our readers, don't forget to pick up our latest issue of New Beauty featuring Catherine Zeta-Jones, of course, and featuring our 11th annual Beauty Awards, which we will be celebrating on April 21st at 8 p.m. Please join us. Thank you again, Dr. Williams.
Thanks a lot.
Thank you, everyone. Have a great day.
Okay, bye-bye.